This medication is used to treat a specific type of cancer called uveal melanoma. Tebentafusp is a type of drug called monoclonal antibodies, which helps to slow down or stop the growth of cancer cells. It is important to follow the dosage instructions provided by your doctor and to take it at the same time each day for the best results. Before starting Tebentafusp, be sure to read the patient information leaflet from your pharmacist and ask your doctor or pharmacist if you have any questions. This medication is given by injection into a vein once a week, usually over 15 to 20 minutes by a healthcare professional. The dosage will be based on your medical condition and response to treatment. Your doctor may also prescribe other medications, such as dexamethasone, to help reduce side effects. They may start you on a low dose and gradually increase it to reduce the risk of side effects. Some common side effects of Kimmtrak may include dry/itchy skin, changes in skin or hair color, swelling, or muscle/joint pain. If these effects persist or worsen, it's important to inform your doctor or pharmacist. While there may be serious side effects associated with this medication, your doctor has prescribed it because they believe the benefits outweigh the risks. Your doctor will monitor you closely to minimize your risk. Be sure to contact your doctor immediately if you experience any signs of liver problems or develop a rash. Although skin redness, itching, swelling, or a rash are common, it's important to notify your doctor to rule out a rare, severe reaction. In rare cases, a serious allergic reaction may occur. Seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects, be sure to consult your doctor or pharmacist. If you're in the US, you can report side effects to the FDA. In Canada, you can report side effects to Health Canada. Tebentafusp can cause a serious side effect called cytokine release syndrome, CRS, which can sometimes be fatal. You will receive this medication in a hospital or clinic so that your doctor can monitor you for any serious side effects and provide treatment quickly if needed. After the first 3 treatments, you will be monitored for at least 16 hours, and for at least 30 minutes after later treatments. If you experience symptoms such as fever, chills, headache, nausea, vomiting, stomach/abdominal pain, trouble breathing, skin rash, tiredness, or low blood pressure, it is important to tell your doctor right away. If you experience side effects, your doctor may temporarily stop or slow down your treatment with this medication. They may also prescribe other medications before you receive Tebentafusp to reduce the risk of side effects. Before starting Tebentafusp, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your healthcare provider. Additionally, it's important to discuss your medical history with your doctor or pharmacist before using this medication. Tebentafusp may cause dizziness, and the use of alcohol or marijuana can intensify this effect. It's important to avoid activities that require alertness until you can do them safely. Limiting alcoholic beverages and discussing marijuana use with your doctor is also recommended. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor. Tebentafusp can harm an unborn baby, so a pregnancy test may be ordered before starting this medication. Reliable forms of birth control should be discussed while using this medication and for 1 week after the last dose. If you become pregnant, it's important to talk to your doctor right away about the risks and benefits of this medication. It is not recommended to breastfeed while using Tebentafusp and for at least 1 week after the last dose, due to the potential risk to the infant. Consulting your doctor before breastfeeding is important in this case. When taking Kimmtrak 100 mcg/0.5 ml intravenous solution antineoplastic, immunotherapy, T-cell engager, it's important to be aware of potential drug interactions. This can affect how the medication works and may increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor first. It's important to follow your doctor's guidance for the best results. If someone has taken too much Kimmtrak and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. During the use of Kimmtrak, it is important to have regular lab and medical tests, including a complete blood count and liver function tests. It is essential to attend all scheduled medical appointments and follow-up tests. Make sure to take each dose of Kimmtrak 100 mcg/0.5 ml intravenous solution Antineoplastic, Immunotherapy, T-cell engager on time as prescribed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to determine the best course of action for a new dosing schedule. This medication, Kimmtrak 100 mcg/0.5 ml intravenous solution, is used as an antineoplastic immunotherapy for T-cell engagement. It is typically administered in a hospital or clinic setting and should not be stored at home. This medication is used to treat certain types of cancer and should only be given under the supervision of a healthcare professional. The dosage and timing of this medication will be determined by your healthcare provider based on your individual needs and condition. Be sure to follow their instructions carefully and ask any questions you may have about the best time to take this medication. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.